In this video, I'll be discussing the specific approach I take for surface ear surgery. What is surface ear? It's a condition where bone lesions form in the external ear canal. When your ears are repeatedly exposed to cold water and cold wind over many years, the bone begins to grow, eventually making the canal very narrow. The biggest challenge in surgery is removing those bone growths while carefully protecting the delicate skin inside that narrowed canal. Unique feature of my method. My approach to surface ear surgery have two unique features. You can see some feedback here from surfers I've treated on Instagram. First, while ear surgery is often done by making an incision behind the ear, I use a minimally invasive method, making a very small incision directly through the ear canal. Second, unlike conventional surgery that rely on a drill, I never use a drill. Instead, I use three specialized tools. First, a tiny 1mm wide chisel, a small silent hammer to gently tap the chisels, a small spoon-like instrument called a bone curette. Background and experience. This technique was originally developed by Dr. Douglas Hetzler in the United States. I learned it directly from him in 2012, and since then, I've performed this procedure on over 400 surfers. Since most patients have both ears treated, I have completed more than 800 surface ear surgeries. Over the years, I've refined the method and now use my own original incision technique. There are three key benefits to this approach. First, it's gentle on the ears because there is no drill noise. There is far less risk of damaging the auditory nerves. It means less hearing loss and less tinnitus. Second, comprehensive removal. I can remove a lesion right up to the eardrum. Since my patients are dedicated surfers who want to keep getting in the water, it's vital to remove as much as possible in the first surgery. This helps prevent future complications if the condition recurs. Third, fast healing and minimal pain. By leaving the skin intact, recovery is so quick and there is almost no post-operative pain. The challenge and my philosophy. The only real disadvantage is that operative inside such a narrow space requires high level of skill. It was challenging when I first started, but now, to me, it's easier than surfing. You could say I've become an ear shaper. Recovery schedule. The surgery is performed under general anesthesia. Afterward, we place a small amount of gauze in the ear to manage bleeding. This is removed within a couple of days and your hearing gets better soon. Most patients feel very little pain. For the question every surfer asked, when can I get back in the water? Usually you can resume surfing just 2 or 3 weeks after surgery. Who is that for? I highly recommended this surgery for those suffering from symptoms of surface ears, repetitive inflammations and hearing loss, ear pain, and those who want to get back to surfing as quickly as possible, those who want to both ear treated at the same time. And for surfers who love to travel, Japan is a beautiful place to visit. You can enjoy some sightseeing before or after your procedure. Patients come to see me from all over the country, and the cost of treatment here in Japan is significantly lower than in many other countries. A minimum stay of 5 days is required. For more details or to get in touch, please check the link in the description. I'm here to help you get back to the waves. I hope we can surf together when I go to your beach. Thank you for watching. See you.